in every newscast, we've been answering your questions about COVID-19 and the vaccines. And our expert today is Dr. Mark Seidner, the epidemiologist within the Department of Infectious Diseases at Mass General Hospital. Doctor, good to see you. Thanks for joining us once again. We're getting a lot of questions about an allegation, and I say that, allegation, circulating on social media. It claims that the CDC is covering up the number of vaccinated people who test positive for COVID. So can you explain why this data about breakthrough infections is now a target? And do you think that doctors and the public are being misled about the numbers?
Yeah, this is, I think, a simple misunderstanding. Positive tests are collected for clinical purposes, for screening, for contact tracing by labs who report them to the state routinely. They're required to report them. And this is really irrespective of vaccine status. Very separately from that, the CDC and many research groups, including ours at MGH, is very interested in knowing whether variants are causing these breakthrough infections. Now, to do a test for a variant, you need to sequence the virus. That takes a lot of virus. And so the CDC, for these research studies, not for the clinical reporting of tests, but for these research studies, is restricting the studies to people who have a lot of virus in their tests. This has nothing really to do at all with how we track the virus, how we track the epidemic, or how we estimate whether the vaccines are working.
Doctor, let's move on to some other questions that we've gotten. Camille writes in, I received the J&J vaccine in March of 2021. I just read today that it only has 66% efficacy. Am I fully covered for COVID-19 and the variants? What's your answer?
Yeah, so what we care most about these vaccines is whether they stop people from getting sick, hospitalized, or even deaths. And in the J&J study, the efficacy of these vaccines to prevent people from being hospitalized was over 80%. It was over 90% 2 months out from vaccination. So I think both this vaccine and the others are really showing us what we want to know. They're very safe, they're very effective, and they're stopping people from getting sick.
Patricia wants to know, I received both doses of the vaccine and did not experience any side effects. Am I fully protected? A lot of people want to know that.
Yeah, it's a good question. So side effects vary by age. They also vary by whether people have been infected before they were vaccinated, but certainly not everyone gets them. In the Moderna study, only about half of people got any side effects after the first dose, and only about a quarter after the second dose. We don't really know all the reasons why some people get side effects and some don't, but even though not everyone does, protection rates were 95%. So you don't need to have side effects to be protected from these vaccines.
Jake asked tonight, my wife and I are both fully vaccinated. Do our kids who are 5 and 3 still need to wear masks after everything opens back up?
Yeah, so the most recent guidelines for the CDC really pertain to people that are vaccinated. We continue to recommend that people that aren't vaccinated wear masks indoors when they're not around their immediate family and in crowded spaces outdoors. But there are two things to keep an eye out for. One is rates, hospitalization, deaths have come down, vaccination rates have come up. If that continues in Massachusetts over the next few weeks to months, I think we're going to see restrictions actually continue to fall off. And the second is we're currently doing studies in children as young as 6 months for these vaccines. So I'm hoping that by the end of the year, people almost irrespective of age will be eligible for vaccination.
As young as 6 months, Dr. Seidner?
That's right. That's what the studies are currently doing.
Wow. Dr. Seidner, thank you so much for your time. It's great to see you.
Thank you, doctor.
Sure.